Okay, my name is Michelle Perko, and I am a social worker on the STAR unit. I've been with the hospital about 10 years almost. So I've seen a lot of the changes with the system, the mental health system, and the increase in demand for the competency and the restoration needs from the legal system, and how that's changed how we operate as a hospital. And really, if you flip this over, there's a graphic on the back side that you'll see kind of a cycle. I think it'd be easier for me to kind of explain this than to go through the text. You guys can read the text later. But really what it's showing here is kind of how that change with the demand of the legal system changed how we operated and how we are serving the mentally ill in the community. So if you can see here, the detainment and CMH IP bubbles are larger because what we're seeing is more and more referrals from the legal system into the hospital, getting kind of backlogged in jails and then backlogged here once they get here, because we're not big enough. And I'd like to use the analogy of the sink. How we're addressing that, it seems, is creating more outpatient restoration with funding, creating more beds here at the hospital to get people into the hospital. And what I think we're seeing kind of as a side effect is that it's becoming bottlenecked maybe at the bottom of the sink, at the drain of getting people back out of the hospital and back into the communities to create that movement through the hospital and back out. And what I've noticed in the last 10 years is when we shifted from having civil patients to forensic patients, we stopped serving the mentally ill in the community through the mental health centers. They no longer had us as a resource for the severely mentally ill. They're using local hospitals, short stays and ERs to get, barely stable and then sent right back out, not really getting good stabilization and prevention and maintenance in the community of our most severely mentally ill. And what happened when that changed, we lost the reciprocal relationship with the community mental health centers. They used to come to the hospital, they used to be involved in treatment and discharge planning, providing wraparound services, helping us with discharge planning, making sure that when these people get back in the community, they're well taken care of. And they're not coming back around and having this recidivism and this cycle. And so what's happened with that is with the cutoff of our ability to serve them, it cut off their ability to serve us here directly. And so what we're doing now with the mental health centers is maybe getting an intake. That's it. That's all that the community mental health centers are providing to us. Not even a provider appointment, which is violating the contract that they have with us, with our patients, to have a provider appointment within 2 weeks of discharge, to have kind of that real wraparound services for our severely mentally ill. And so what we're seeing is a lot of these people are falling through the cracks after they leave here. What we're seeing too is these severely mentally ill people, when they miss an appointment at the mental health center, they're being terminated as clients. They're not being pursued, they're not being followed, no one's going and knocking on their door. And so what we're seeing is people falling apart in the community and then just ending up with the legal charges and just continuing to backlog the legal system because we're not really taking care of the severely mentally ill in the community. And so I don't know how much time I have. I know I was told to talk quickly, but that's kind of just a real basic picture of what I've seen change over 10 years. I've seen kind of some issues here as far as the bottom of the sink being small. The social work department here, we're working with less FTEs than we had 10 years ago when we had all that support and help, and we're trying to keep up with the demand of the increase at the top of the sink with the same amount of resources at the bottom, actually less resources at the bottom because we don't have the mental health centers anymore helping. Now we did get momentum. I put momentum over here. That's really great incentive for community providers to take our people for the short term. They're helping us pay for beds when we're having issues with the benefit system. I'm sure you heard about that earlier with Dan. It's kind of helping people be like, okay, if that doesn't work, we'll kind of use momentum. But it's not a long-term maintenance and prevention for our severely mentally ill that the mental health centers aren't really doing. I don't know if they feel like they're not supported because they don't have inpatient anymore with us, and that's really hurting them, or how much accountability these mental health centers have in providing for these really severely mentally ill. I've seen ACT teams shrink, wait lists for ACT teams. That's huge for us, the intensive case management. I don't see mental health centers taking court-ordered meds anymore when they used to, or certifications transferring to the community with our really severe guys that need that. It's not even an option anymore. So what they've been able to provide for us has pretty much almost been dissipated. I don't know how we're taking care of people in the community, I guess, like we used to. So I think I'll leave it at that. But if you have any more questions for me, I put a lot more detail in the notes here on the other side and with my contact information. but hopefully that kind of spoke to just what I saw as a picture of the system changing.
Yeah, and thank you for writing it down.
Sure.
Yeah.
Really helpful. Can I ask just one question? What's the STAR unit?
STAR is it's a new unit for me, but it's the guys that aren't being restored to competency
Okay,
who move through the system and then are kind of ready to reintegrate into the community.
but they never got restored to confidence.
They didn't get restored, or they're NGRI, and they
Oh.
have to kind of move through the system, increasing privilege levels slowly until they get to our more NGRI units. So we're doing a lot of discharge from the STAR unit back to the community.
Okay, great. Okay. Thank you. That was great.
Thank you.
Thank you
Thanks
guys.
so much.
Appreciate
Appreciate
it.
it.